Did you ever feel so bloated in your abdomen that people thought you were pregnant? Well, that's what a recent new patient with ulcerative colitis told me, and that's what we're going to go over today, what causes it and how to clear it up. So my name is Dr. Thomas Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida, and author of the book, The FreeDiet. So when this patient came in, a 51-year-old woman, she was not only complaining of bloating, but the usual abdominal cramps, diarrhea, indigestion, and along with that, fatigue, insomnia, skin issues, anxiety. She was just feeling terrible. So I know for over 20 years, she's had ulcerative colitis, has been to different doctors, on the usual medications, still on medication, just still feeling terrible. When your gut's not feeling good, I mean, it's just hard. It affects your entire body. So she wanted to know what was causing it, so that's what we did. We did an evaluation with some comprehensive testing, and I look for underlying root causes in typically 5 main areas. And those 5 main areas are deficiencies, toxins, infections, food reactions, and hormones. So for her, I mean, she did have multiple deficiencies. Vitamin D, she was deficient in, folate, B12, and some other nutrients. So those are the most common ones I see. And if your vitamin D is low, that can have a really significant effect on your immune function and inflammation and a whole cascade of events. So that was one thing that came up under toxins. She had above optimal mercury levels in her body. Under infection, so that's a big one for digestive issues. Ulcerative colitis in particular, she had excessive amounts of bacteria in her stool as well as yeast overgrowth. And I commonly see that with our patients that have IBS or colitis, is just that bacterial overgrowth and yeast overgrowth. She had both. And then under food reactions, so gluten, I see that over and over and over again with chronic gut issues, which she had, very high gluten sensitivity, along with some other food allergies and sensitivities, and leaky gut as well, which is increased intestinal permeability. And on top of that, when all of that's off, it's typically affects your hormones, as is in the case with her. So she had low levels of adrenal hormones, cortisol, DHEA, as well as testosterone and progesterone, estrogen were all low. So all of that was low. So if you think about it, if you're having chronic gut issues, again, over 20 years with her, you're going to have deficiencies. It's going to affect your hormones. It's going to affect really your entire body. So what did we do as far as providing solutions to this? 2 areas are diet and supplements. So I came up with a diet I call it FreeDiet because it's not only free of gluten, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods that are most commonly responsible for inflammation, autoimmune, and other chronic health issues, particularly gut, thyroid, and other chronic issues. So the thing is, when you're just, like, people go, oh, like even she said, well, I tried avoiding gluten for a while, but I didn't really feel that great. Well, that's because there's a whole lot more to it than that. So what I find is by avoiding all these foods initially, you can really make a lot of progress, which is what she did. And then as far as these supplements go, so in addition to the functional 5, I call it, that's multivitamin, fish oil, vitamin D with K, magnesium, and probiotic. We also use for digestive issues, colitis, IBS, and other digestive issues, as we use with her, GI mends, gut immune repair. Both of those to help promote gut healing and support. She had yeast and bacterial overgrowth, so we use yeast defeat, microbalance, as well as curcumin protect, which supports healthy inflammation and immune function. And then based on your specific deficiencies, like we also had it with her methylfolate, B12, as well as DHEA and what we call adrenal vibrance. Those are adrenal support formulas. So putting that all together to address these 5 areas of underlying root causes, after a month's time, she came in, she was feeling so much better. She didn't feel pregnant anymore, so her bloating, her gut symptoms were substantially improved, and she dropped 10 pounds that first month. So she's at her ideal weight. She was thrilled about that. She continued to improve, and at 3 months, when we did some follow-up testing, she had, in her stool test showed her that bacteria that was positive before had cleared up. Her mercury levels were at normal, down to optimal levels. Her DHEA had improved. Her adrenal function had improved. Inflammatory markers were down to normal. So another thing that improved, her ANA was very high when she first came in, and at 3 months, now it was completely better, completely normal after 3 months, this autoimmune marker. So we were thrilled about that. Her gut symptoms and her skin issues, she just didn't have any more gut symptoms at all. She had more energy. All of her other symptoms were either resolved or considerably better. So she was feeling great, the best she had in years. She's working out regularly. So the thing is, when you have these chronic gut or thyroid or other autoimmune or other issues, if you find out what the underlying root causes are and are provided the proper solutions, I believe most everyone can get better. So if you like this video, click thumbs up, feel free to subscribe, and as well, the FreeDiet Phase 1 food chart, I'll provide a link below in the description, so click on that if you'd like a free copy of that food chart, and I look forward to seeing you next time.